in a big picture sense, how many, let's just say, patients that are either under direct checking to see if they actually have it or, in fact, have it, what is the surge capacity for the state? How many people actually would be putting us at the part where we're actually needing to get help?
So are you speaking from a Chair Salinas representative, and from a public health perspective, we have a public health system that includes our tribal and local public health partners as well. And so both within the state and within those systems, there's the ability to pull additional people often into a response. So right now, the active monitoring of patients who are under monitoring requires daily calls. If those numbers increase, we may get to a point where there's kind of less frequent calls, but for those who have been compliant, because we've seen really good compliance across these, and we would continue to try and we have emergency responders that we can pull in within OHA and within our local public health authorities to expand the workforce on a temporary basis to respond to a crisis like this.
I would hesitate to want to try to give you a number, not because I don't want to be transparent, but because inevitably in a circumstance like this, as it develops and worsens, the system, us, hospital systems, other healthcare providers, local public health, tribes will shift and respond and adjust our response to meet that. And anything I would try to come up with as a number now would be almost completely hypothetical and not reflect on that. The other really important thing to remember is that we do not have evidence that this is that our context should be everyone's going to get this if it becomes present in the state. Everywhere that it's been, it continues to be a very small percentage of people who get it, and an even smaller percentage of that who become seriously ill as a result. So there's nothing on the horizon out there as we see this today that leads us to automatically think that that's the horizon we're headed toward.